Okay, perfect. And tell me a little bit about some of the requirements of your job right now and how what you learned in high school is helping you.
Yes. So I'm a medical assistant. So as a class I took in my senior year, so we learned a little bit about everything. So it was kind of fast. But the good thing is that in my junior year, I took phlebotomy and EKG, so that helped me because it's under the requirements for a medical assistant. So I pretty much do everything. I really like it because they're really lenient with my schedule. I'm full time here at work and in college, so it helps me there. They also help me if I ever need something or anything. They always help me. As a medical assistant here, I depend what I do, what day I do. We usually see new patients. I do phlebotomy, I do EKG, I give injections, I call patients, I'm with patients, and then eventually I just pass them on with the nurse.
And when you interviewed for the job, was your HOSA experience, was that helpful?
Yes, because they want someone mainly with experience and that is someone responsible, not just someone random or anything. They want someone with experience, and also I was an officer for HOSA, so which is what helped me even more.
And finally, what do you're getting your foot in the door right now in
yes,
the healthcare.
Also, I hope to become a nurse, so then I know that we need experience, and I think medical assisting, knowing that I've been here working here since I'm a senior in high school and then working all the way up there. So I think that's going to help me a lot because I have experience not like someone else. I mean, they might have experience, but I'm working with nurses, with the doctors, and I work with everyone. So I think that gives me an advantage if I would try to become a nurse or when applying for it.
Okay, perfect. Brenda, thank you so much. And best of luck. I know that's tough working and going to school.
Yes, thank you.
Hello, my name is Carlos Ponce, and I'm here today to talk about my experience, not only as a CTE student in high school, but I was also in HOSA all 4 years of my high school education. I took, kind of the way we have it structured now. I started off with principles of health science, and then I took medical terminology, and then my junior and senior year, I can't think of the names of them off the top of my head, but we didn't offer the certifications that we have now, which I'm so proud of these students. Brenda Gonzalez, the one that was speaking just a few minutes ago, she was my student her junior and senior year. So we talk a lot about the same things that we did when I was in high school because it mirrors a lot of what they're learning today. And it was just a great experience I had. All 4 years I was in HOSA. Back then it was called Health Occupation Students of America. Now it's HOSA Future Health Professionals. So they've changed the name, but the events are still the same and the experience is still the same. During my time as a HOSA student, we learned how to interview. We learn how to be competitive, but in a constructive way. You're with like-minded individuals that have a common goal. They have some sort of vested interest in healthcare. And to be around those students and that atmosphere and that energy, it just does something to you at that age. It motivated me so much to go to the next level, to do well in college. And eventually I became a nurse. I was a nurse for 7 years, and then I jumped over to education. The reason why I jumped into education was because I had such an excellent experience in high school, to be honest with you. My health science instructors, I loved the way they taught me. And I knew that someday, I didn't know when, but I thought I was going to do the same thing. And so now I get the opportunity to do that at McAllen High School.
Oh, perfect. And what would you say are the skills that you learned in high school that are still helping you today?
For sure, just a few would include how to interview, how to public speak, how to organize yourself. In healthcare, if you're going to do anything in medicine, you have to be a very structured, organized person. And that definitely helped me a lot. Networking with other students. I mean, we do it now as teachers. We have to network with community health officials all the time, leaders in the hospital. All of those things, in one way or another, we were doing that back in high school, but with our peers. And now we're doing it with colleagues and with other healthcare professionals. So it definitely translates over without a doubt.
Okay, perfect. Mr. Ponce, thank you so much.
No
Appreciate
problem.
it.
Thank you.